Welcome. I am Lucinda Curran, your host for the Environmental Sensitivities Symposium, a world-first event. Today I have the pleasure of introducing you to Dr. Christabelle Yeoh. So Christabelle, could you tell us about the work that you do, please?
Well, I've been working in environmental medicine since 2006, and mainly I see patients with fatigue, allergies, intolerances of all kinds, gut problems, neurodevelopmental issues like autism spectrum, chemical and electrical sensitivities.
So how did you come to do this work that you're doing, or even what was your personal journey to get there?
Well, after working in hospital and acute medicine for some years, I decided to go to learn more about nutrition and environmental medicine. I joined a private practice just outside of London called Breakthrough Medical Group, which was well known and still very well known for environmental medicine. It was founded by a super doctor called Dr. Jean Monroe. So I worked with her for quite a few years. I trained with the American Academy of Environmental Medicine, and then I continued to be involved in England with the British Society of Ecological Medicine. And now that I live here in Australia, I've been involved with the Australasian College of Nutritional and Environmental Medicine. So it's just been a journey of learning more and more about environmental medicine.
That sounds exciting because I'm a big learner. I love learning myself, and it sounds like you are too.
Indeed.
So, you went from working in the hospital to then working with the environmental medicine. So what prompted that change?
Well, I suppose I was interested on a few different things at different levels. So in the first instance, when I was dealing with patients in my clinic, I quickly discovered that I couldn't do very much in 10 minutes, and really just relying on drugs and just treating symptoms, these patients would come back repeatedly. So that was one aspect. I became very dissatisfied with my practice of medicine. And the other aspect was that my father, he's a surgeon in ear, nose, and throat. He was also unsatisfied because he might be needing to do recurrent sinus surgery or tonsillectomies and recurrent conditions relating to ear, nose, and throat, which was in fact due to food allergies. So he went off to America and learned about food allergies. So I grew up knowing that there was chronic medical conditions which were related to food intolerances, and seeing what he'd gone through, that was at the back of my mind. So I went back to study nutritional medicine, and then I joined an environmental medicine group.
So what is it that makes you so passionate about the work that you do now?
Well, I find it's a huge field that's constantly mind-expanding, and there's a huge amount of work to know a lot about not just the external environment, but also the internal environment and how they relate to each other to create, in a person, in a human being, the state of mental, emotional, physical well-being or lack of it. And so that's why I love it. There's just so much to discover and so much that can be done.
Before you mentioned when you sort of became dissatisfied, it was more so about the 10 minutes with somebody and using just drugs. So how does your practice look now? What sort of things are different?
In a new patient consultation, I usually will spend at least an hour to an hour and a half going through the current problems, presenting complaints, past medical history, and the whole background of a person. And we do a lot of questionnaires before the consultation too, about the person's environment, where they've lived, what they're exposed to, how they eat, occupational history, and all kinds of things. So I can build a quick picture and a summary, a quick picture that's over an hour to an hour and a half of a person's whole lifetime of environments and exposures. And then that gives me an idea of which direction to work in. And then future consultations may be anywhere from 30 to 60 minutes. Yeah, so that I spend a lot more time with people.
And that would be a lot more satisfying, I'd imagine.
It is, yeah, it is.
And then also you said before when at the stage when you were dissatisfied, you were using, a lot of drugs as treatment. So I'm guessing that's also changed?
Yeah, I use drugs where I need to use drugs, particularly in acute situations. But when you can find out all of the biochemical, nutritional, environmental factors that contribute and add up to a person's ill health, then you can take steps to reverse them and not have to use or just rely on drugs, or eventually get people off drugs as we work more with nutrition and detoxification and digestive health and environmental health. Yeah.
That would be so exciting just to see the changes that you can create even without the drugs.
Yeah, it is. It's really satisfying.
And so then what's the best part about your daily practice now?
Well, I think that we are very complex human beings, and it's really fun to help people map out what steps they need to take to find, discover back their energy, their vitality, their mental and spiritual well-being, because people often become depressed and have poor mental health because of their poor physical health. But it's a vicious cycle, and then people just end up being treated as having a psychiatric condition. But I find that the best part is when people are willing to join me, like together we go on this journey, and seeing them engage with it, when people realize it's not a magic bullet, whether it's going to be just medication or herbs or just a single therapy, whether it's a conventional or a complementary therapy. And when people realize that our bodies and our existence doesn't just fit in a reductionistic model of medicine, and they're willing to, go with that, that's great.
It is. And you mentioned too that you work on spiritual well-being as well.
Well, I think that we can't really divorce our physical and mental well-being from our sense of our spirit and who we are on this, on this earth, where we come from, why are we here, what are we doing, where are we going, and that sense of direction, passion in life, and finding your spirit. So I think that, you can't remove that from a person's physical health, but then also if they've lost that sense of spirit and who they are, that's not really going to help them build their physical health. So there's a bit of coaching alongside doing, integrative or nutritional or regular medicine that I think is important.
And it sounds too that it's a lot about teamwork. You're, I guess, leading the way, but it's the team. It's, you with the patient working together on their health.
Yeah, I see it more as I'm pointing some of the ways. Perhaps you can lead a horse to water, but you can't make it drink. So I'm pointing in different ways, and yes, it's teamwork. We go together.
And what's the benefit you find of that teamwork rather than, I guess, the classic doctor-patient relationship?
Well, because we're not working on a reductionistic model of medicine where you just take this pill and you do what I say, and then you will, get these various outcomes, which anyway are fairly limited. You need that teamwork, and you need the person to engage and to be willing to make changes, go through challenges. Some things work, some things don't work, but we just keep going on this journey of discovering, because every time we discover something that doesn't work, that takes us closer to the next thing that could work. And so doing this kind of challenging work, whether on a physical level, mental, emotional, spiritual level, just doesn't work if you're just told what to do.
And I guess, too, the other benefit of working together like this is they're just so much more engaged in the whole process and willing to go on that journey, because it sounds very much like there isn't a one-size-fits-all with your approach. It's all very individualized. Is that right?
It's pretty individualized, but also because I treat a range of quite complex conditions, so it's hard to just, give you straight up a protocol. I work very much by first principles, and so, yeah, people have to engage in the process.
And when you talk about first principles, what do you mean?
I mean by understanding our physiology, our bodies, how things work, our physiology, our biochemistry, our electrical sides, so the electricity, including, the whole brain and body, and then really understanding how what nature has provided for us, and our bodies are really just a reflection of nature. So taking and learning from nature and working with it rather than working against it.
I needed to ask that so everybody understood what you meant. It's a beautiful way to work.
Yeah, I like it.
So everybody, Dr. Christabelle Yeoh will be a speaker at the Environmental Sensitivities Symposium, and you can find out more at environmentalsensitivities-symposium.com.